Hi. So let's talk about impingement issues that happen around the ankle joint. So this is the front of the ankle joint. You have the shin bone here and the talus here, which makes the ankle joint. This is the fibula, of course. Impingement here can be from bony spurs or osteophytes, which grow at the end of the shin bone here and also at the talus. Then the foot dorsiflexus, which means that when the toes move upwards, these two bones can impinge and cause pain. This is more common in footballers, so much so that this has been called as the footballer's ankle. Easily treatable, of course, initially non-operatively, and if none of these improve, then they're very amenable for arthroscopic treatment. Sometimes opening up slightly and giving a good clear out also helps. It can be a soft tissue. There is a ligament here which sometimes sends an abnormal slip down here, which can be easily treated with resected with an arthroscope. Scar tissue develops in the gutter here, and that can be removed by an arthroscope as well. The outside of the ankle, the side of the ankle, and let's first look at some of the fractures that can happen here. So this bone is the talus here, the talus, and this is the lateral process of the talus. Snowboarders can fracture this process by impact, and it's called as a snowboarder's fracture. Often, if it's tiny and if it's causing problems, then the fragment needs to be excised surgically. But if it's a big chunk, then it has to be fixed in situ over there. And then this is the heel bone, and this is the front of the process here of the heel bone. There are a couple of muscles attached here called the extensor hallucis brevis and the extensor digitorum brevis. Basically, they help in extension of the big toe and the rest of the toes. So this muscle which attaches here can pull off a fragment from this bone here. Again, if it's very tiny, it needs to be excised. If it's a big enough chunk, it has to be fixed. Another fracture that can happen is the end of the fibula fracture. Again, there's another ligament which attaches over here called the ATFL, the anterior tibiofibular ligament. If that pulls off, it'll pull off a fragment from the front here. There's another ligament called the calcaneofibular ligament, which attaches over here. And if that pulls off a chunk, it'll be over somewhere here. The other soft tissue problem that athletes can get in the outside or the lateral side of the ankle are to the peroneal tendons. The peroneal tendi, they traverse over here, and the tendons come around this end and go here and down the foot. The main job is eversion of the foot, that is this kind of outward rotatory movement. With repeated friction, they can undergo wear and tear, splits, and sometimes rarely rupture also. Sometimes the tunnel through which it goes can be a bit weak, and they tend to slip over the lateral malleolus, what we call as subluxation or instability of the tendons. So, like always, most of these can be treated non-operatively initially with relative rest, immobilization, anti-inflammatory medication, sometimes injections. But if none of these work and if it continues to be a problem, then surgical intervention is required. The back of the ankle, this is the talus and this is the heel bone here. So there are a couple of issues that can cause problems with athletes and dancers here. So the one is there is a bone called the os trigonum which develops here, just at the back of the talus here. That itself can lead to impingement, but most of the time it doesn't cause any problems. But if it does cause impingement, especially when the foot plantar flexes, which means the foot goes down and this comes up, and this can create an impingement issue. Then, of course, it needs to be treated initially non-operatively, and of course, if it continues to be a problem, that may have to be removed. Sometimes that impingement, it can also be associated with what we call as an FHL tendinosis. FHL is flexor hallucis longus. Again, it's a big beefy muscle that comes here, and then it forms a tendon. It goes around like this and goes and attaches to the big toe. It helps in bending the big toe. So dancers who go on point A, on the tip of the toes all the time, can abrade this tendon over here, all along this path here, and that can lead to problems of pain and difficulty to carry on with dancing. So tendinosis or wear and tear of the tendon may have to be treated again with relative rest, injections to help it regenerate or to reduce the inflammation if there's any. and then eventually, if nothing helps, surgery has to be done. And if there's an os trigonum also contributing to impingement, both need to be sorted. Os trigonum has to be removed, and the tendinosis of the tendon has to be addressed as well. The back of the ankle, this is the talus, and this is the heel bone here. So there are a couple of issues that can cause problems with athletes and dancers here. So the one is there is a bone called the os trigonum which develops here, just at the back of the talus here. That itself can lead to impingement, but most of the time it doesn't cause any problems. But if it does cause impingement, especially when the foot plantar flexes, which means the foot goes down, and this needs to be treated. Initially non-operatively, and of course if it continues to be a problem, that may have to be removed. Sometimes that impingement can also be associated with what we call as an FHL tendinosis. FHL is flexor hallucis longus. Again, it's a big beefy muscle that comes here, and then it forms a tendon. It goes around like this and goes and attaches to the big toe. It helps in bending the big toe. So dancers who go on point A, on the tip of the toes all the time, can abrade this tendon over here, all along this path here, and that can lead to problems of pain and difficulty to carry on with dancing. And if there's an os trigonum also contributing to impingement, both need to be sorted. Os trigonum has to be removed, and the tendinosis of the tendon has to be addressed as well. So there's another problem that can happen with the FHL tendon. The tendon, like I said before, it runs along this groove here and down and attaches to the big toe. Sometimes due to repeated wear and tear, the inflammation can produce a small swelling in the tendon, or a nodule as we call it. The tendon can produce a nodule, and this nodule can get stuck as the tendon glides, and that can lead to triggering of the big toe, like we see triggering in the fingers and the thumb. And this triggering can sometimes get stuck permanently, giving rise to an appearance that the big toe might be permanently fixed in one position because the nodule here is stuck somewhere. And this again, if it becomes a problem, may need to be addressed surgically. Okay, coming to the medial side or the inside of the ankle, the prominent bone here is the medial malleolus. Again, we have the talus here, and this projection from the heel bone is called the sustentaculum talus, which supports this talus bone. Sometimes this can get fractured. And then the other structure is the tibialis posterior tendon, wear and tear or tendinosis. Of course, we've seen the FHL which goes behind. The FHL is mostly affected in dancers, whereas the tibialis posterior is more often affected in athletes and sports people. After that, then there's another important ligament called the deltoid ligament, which fans out from this medial malleolus all over there, and repeated rolling of the foot, inward rolling of the foot, what we call as pronation technically, which can happen when dancers, can lead to a chronic strain of this ligament. And then there's another ligament called the spring ligament, which can get injured or sprained. The spring ligament transfers from the sustentaculum talus to this bone called the navicular. Again, there is a condition called the soleal syndrome, which causes a lot of pain in athletes over here. This is very similar to the shin splints, but usually shin splints happen higher up above the shin, where the soleus muscle attaches. So this soleal syndrome is very similar to that, only it's happening only because there is an abnormal attachment of the muscle which comes lower down, and that seems to cause this. So to summarize, as we saw, the foot and ankle is a complex structure. It has lots of little bones, long and short, lots of joints there, lots of tendons, blood vessels, nerves. So all sorts of problems can happen in the athletes or sports people or dancers. So it requires careful attention to the history, their training program, careful examination to find out which structures are causing problems, appropriate investigations, and then to determine what treatment will benefit them, whether it's non-operative measure or operative means by which we can get back to their dancing routine as soon as possible. Of course, the athletes, for their part, in order to prevent these injuries, must pay careful attention to proper technique, and make sure that they're not overdoing it, because overuse problems can be very difficult to deal with. And if they start developing a problem, not to ignore it. Early visit to a specialist will help them identify the problem and deal with it early on than much later, because early on there are always non-operative measures that can help the athlete or the dancer to get back to their routine earlier than later.